Hello, I'm Mandy Keim, Director of Safety Services at Associated General Contractors of Washington, and this is our COVID-19 awareness training video. As we have all seen from the Center for Disease Control, Department of Health, and local health authorities, we all have responsibilities for protecting ourselves, our families, and our communities. So your attention to these job site requirements is necessary for the protection of all. In this video, we will review the employee requirements, job site requirements, as well as communication and planning expectations. Let's start with getting to the job site. When you arrive on site, you will likely have a temperature scan and you'll be asked questions about your health as a form of screening for the virus. It is important that you answer truthfully. This is one of the ways that we will ensure that we're working with healthy people. A daily attendance log of all workers and visitors must be kept and maintained, so be sure to check in upon arrival following the site requirements. Contractors are responsible for adherence to state and federal laws for worksite safety and health, as well as adherence to gubernatorial orders for the mitigation of COVID-19. The contractor must develop and post a comprehensive COVID-19 exposure control, mitigation, and recovery plan. This post will also include a signed commitment to the COVID-19 job site safety requirements, as well as contact information for the COVID-19 site supervisor. This COVID-19 site supervisor is designated by the contractor and present at every job site to monitor the health of employees and enforce the COVID-19 safety plan. Upon starting work and at least weekly thereafter, a safety stand-down, toolbox talk, or tailgate training on COVID-19 shall be conducted to explain protective measures in place for all workers. Social distancing must be maintained at all gatherings. Attendance will be communicated verbally, and the trainer will sign in each attendee. COVID-19 safety requirements shall be visibly posted on each job site. Social distancing of at least 6 feet of separation must be maintained by every person on the work site at all times. Gatherings of any size must be precluded by taking breaks and lunch in shifts. Anytime 2 or more persons must meet, ensure minimum 6 feet of separation. Identify choke points and high-risk areas on job sites where workers typically congregate and avoid them so social distancing is always maintained. Minimize interactions when picking up or delivering equipment or materials. Ensure minimum 6 foot of separation. This may cause you to be delayed in your movements about the project, so please be patient and remember, your health is most important and definitely worth the extra moments of travel time around the site. As such, some trades may be staggered in their shifts to reduce the number of people on site at any given time. Contractors will provide personal protective equipment such as gloves, goggles, face shields, and face masks as appropriate or required for the activity being performed. Masks, in accordance with Department of Health guidelines or as required by safety regulators, must be worn at all times by every employee on the worksite. Eye protection must be worn at all times by every employee while on the worksite. Gloves must be worn at all times by every employee while on the worksite. The type of glove worn should be appropriate to the task. If gloves are not typically required for the task, then any type of glove is acceptable, including latex gloves. If appropriate, PPE cannot be provided, the work must be stopped until PPE is available. Soap and running water will be abundantly provided on all job sites for frequent hand washing. Workers are encouraged to leave their workstations to wash their hands regularly, before and after going to the bathroom, before and after eating, and after coughing, sneezing, or blowing their nose. When running water is not available, portable washing stations with soap are required. Alcohol-based hand sanitizers with greater than 60% ethanol or 70% isopropanol can also be used but are not a replacement for the water requirement. Required hand washing practices will be posted as a reminder to all near hand washing stations. Use hand sanitizer in between hand washing or after touching your face. Always cover your mouth and nose when coughing or sneezing, as well as other hygienic recommendations by the U.S. Centers for Disease Control. Disinfectants will be made available to workers throughout the worksite and ensure cleaning supplies are frequently replenished. Frequently clean and disinfect high-touch surfaces on job sites and in offices such as shared tools, machines, vehicles, and other equipment, handrails, doorknobs, and portable toilets. If these areas cannot be cleaned and disinfected frequently, the job site shall be shut down until such measures can be achieved and maintained. When the work site is an occupied home, workers should sanitize work areas upon arrival, throughout the workday, and immediately before they leave, and occupants should keep a personal distance of at least 10 feet. If an employee reports feeling sick and goes home, the area where that person worked should be immediately disinfected. Employees should stay home or leave the work site when feeling sick or when they have been in close contact with a confirmed positive case. If they develop symptoms of acute respiratory illness, they must seek medical attention and inform their employer. Employees must also inform their supervisors if they have sick family members at home with COVID-19. As part of the proactive prevention efforts, workers should self-identify symptoms of fever, coughing, or shortness of breath each day, before the shift, mid-shift, and at home. If employees have symptoms of acute respiratory illness, such as fever, cough, or shortness of breath, they must stay home and not come to work until free of symptoms for at least 72 hours without the use of medicine, as recommended by the CDC. Failure of employees to comply will result in employees being sent home during the emergency actions. Employees who do not believe it is safe to work shall be allowed to remove themselves from the worksite, and employers must follow the expanded family and medical leave requirements included in the Families First Coronavirus Response Act. Any worker coming to work on a construction site from any state that is not contiguous to this state must self-quarantine for 14 days to become eligible to work on a job site here. If an employee is confirmed to have COVID-19, employers should inform fellow employees of their possible exposure to COVID-19 in the workplace, but maintain confidentiality as required by the Americans with Disabilities Act. The employer should instruct fellow employees about how to proceed based on the CDC public health recommendations for community-related exposure. And remember, at times like this, we are all struggling with the sweeping lifestyle changes we have had to endure. As such, it is critically important to exercise good health and hygiene practices that include attention spent on your mental health. Some simple ways to invest in your mental health include going for a walk with someone in your household, doing a video call with someone you love, acknowledging your feelings of frustration or fear with others, and looking for levity in this situation. If you need more help or are in crisis, here are some free virtual tools for you. We at AGC care deeply about the safety and health of our workforce and community and are proud to provide this free COVID-19 training program. Thank you for your attention to these job site safety practices for the protection of yourself and others in our community.